Hello, my name is Aurora and I'm a cancer survivor. And this channel is all about how to get through the cancer and healing journey with as much comfort and ease as possible so that you can focus on yourself and your loved ones. And today I am going to share some tips on how to best manage some of the big post-surgical challenges like wound care, yuck, surgical drains, and peeing while being very mindful of leg incisions. And some of these tips can be useful for any type of surgery, and several of these tips will be specifically for those experiencing breast cancer and having breast cancer reconstruction, and those who have had autologous tissue reconstruction, meaning that you couldn't or didn't want to have implants, and so you had to rebuild your chest using your own body parts. So I will very specifically cover tips for those who have had free flap reconstruction using thigh muscle. Not everybody can use abdominal muscles. I didn't have enough tissue in my abdomen to use to rebuild my chest wall and also some muscles along the side of my rib cage. And I had to use my thigh muscles. It's not a surgery that's done very often, and so there aren't as many practical tips for recovery as there are for folks who have had abdominal surgeries or just other types of surgeries for things other than breast cancer. I had a hard time finding anything for free flap thigh reconstruction, so I'll cover that. And hopefully these tips will ease your recovery, whatever type of surgery you've had, because one of the worst things out there is surgical drains. So let's start with surgical drains. I will not sugarcoat this, and I know everyone I know that has gone through this absolutely loathes drains. They hurt. All the doctors and the nurses and the other staff that describe the drains as being uncomfortable have never had to wear the stupid things for 2 weeks straight. And they'll just look at you and nod, and they'll be like, well, yeah, there's some discomfort. No, ladies and gentlemen, it's not discomfort. It's pain. It sucks. Yeah, you wear them, and then you come back and tell me how comfortable, how much discomfort you feel. So if you don't know what I'm talking about, pause the video and click on the link below, and you will see what a Jackson Pratt drain looks like. These little drains essentially look like little grenades, little plastic clear grenades with tubes attached. And these little tubes will go from the little grenade drain into a large hollow needle called a trocar. The trocar will be inserted here on your side. You'll have two of these hollow needles inserted right here. The tube will be attached to the bottom of the trocar, and the tube will go down into the little grenade. And that is your Jackson Pratt drain. And because of the placement of these drains in your side, underneath your arms on your rib cage by your side, it can be difficult. For me, it was difficult to even turn a few inches to get water off a nightstand because I would twist my far side, and that drain, the trocar and the tubes would pull anytime I tried to turn or do anything. So my arms were essentially down. They couldn't really be lifted up much past this level right here, which is not even 90 degrees at the shoulder level. And I couldn't really turn. So your movement is restricted. They're very uncomfortable. You'll be given a sheet to record how much fluid the drains collect, and you'll need to report that to your physician on your post-op checks so they can tell you when it's time to take those drains out. So my first tip about any drain, but specifically about these Jackson Pratt ones, is to be very committed, fully committed to accurately recording all the drain measurements. The faster you can show that the drains are not needed, the sooner you can get them out and be far more comfortable. So don't skip a recording time for the drains, and don't fake the entries either. This is because as uncomfortable as the drains are, they do greatly reduce the swelling and they prevent seroma build up. So seroma is when your body produces a clear fluid that's meant to help cleanse and heal an area that has been traumatized. And that when that clear fluid can't escape, it causes a bunch of swelling, which can further damage your incision. So you do not want a seroma buildup. You want all that stuff out as fast as possible. So don't fake that it's not taking, draining so that you can get them out sooner. Be honest about the recordings, but don't skip a recording either, because you want to be sure to show when it is all done. The second tip on the drains is to make sure that you have a way to place items you need in an easily accessible place where you don't have to twist. So if you have a nightstand or a bedside table that sits far back so that you have to kind of reach your arm back like this, or lean or twist to get it, either move the table or get a temporary little setup that you can put where you can just reach your arm out slightly forward, grab what you need to grab, and slightly back, so that you're not moving or twisting or pulling your arm back and forth. Your arm is right here in a straight line, and you're moving your elbow. And that's it. Move the elbow like a lever, pick up what you need to pick up, move the elbow back, and you're not moving like this, and you're not twisting like this. Because the first 3 or 4 days, that will hurt. It hurt me. Maybe you're stronger and you can just be uncomfortable. But more power to you if that is the case. But whatever you want to have there at your bedside table, water, tissue, chapstick, have some place to put it where you don't have to make those kinds of movements with those trocars stuck in you. My third tip on drains is one that I mentioned in a previous video on post-surgical gear that can help make those first few weeks at home more comfortable. If you're getting ready for any kind of a major surgery, but specifically a breast cancer surgery, I would watch that gear video, because after several surgeries, finally finding some of those products was made all the difference in being able to recover more comfortably. And I don't get paid by any of these companies to share any of those products. So I really did use them. I really did get them, and I really do have these opinions about them. And so this thing I'm talking about with the drains that's in the other video is drain pajamas, or drain jammies. It's a shirt, just looks like a regular cotton, soft, comfortable pajama shirt. But on the inside, if you unbutton the shirt and then open it up on that side panel, or I guess when you close at the front panel, there's a pocket. There's a little pocket in there that you can take the grenade in and put it in the pocket, so that because you want the drain, obviously for gravity, the drain everything needs to go down. So it's going down in the pocket, but it's not, the drains aren't hanging from you, because when you go home from the hospital, if you don't bring that with you, the drain jammies to put the little drains in the pockets, the nurses are going to get safety pins, and they're going to be pinning these tubes to your pajamas and rolling them up and pinning. You'll have these like bouncy, little grenades filled with like blood and fluid everywhere. And I'm like, this is disgusting. And the pockets are much better. So my third tip is definitely check out the drain jammies. They're in the other video, and I'll link the ones that I got below. They're from Amazon USA. I don't know if they're on Amazon other countries, but they're pretty common. They're not rare. 3 other tips about drains is to watch out for blisters or irritation from the tape. So your skin may be far more sensitive than usual after a surgery for a wide variety of reasons. Your immune system's going crazy right now. The chemicals they use to disinfect your skin before and during surgery are really harsh. Having the trocars irritating your skin and muscles is going to amplify your reaction to having foreign things stuck to you. So if you end up getting blisters from the tape, what I would recommend is using something called Tegaderm, and it's linked below. You can buy it, but you can also ask for it when you leave the hospital. You can say, you can ask for a couple of packages of Tegaderm to cover the area in case the tape comes out or the tape irritates you. And this Tegaderm stuff is the thing that I have found is the least likely to give me blisters. And the minute you start to feel something weird and hot and like itchy around your drain site, first check and make sure there's no infection. And if there's no infection, it's probably the tape. But that's what it starts to feel like you're getting a hot, something is weird and it hurts. And that was the tape in my case. And so you need to take the tape off, clean the area, and replace it with Tegaderm. So this means of course, you'll have to have some handy, which brings me to my next drain care tip, which is get some extra supplies beforehand. I ended up having to send my husband to the store like a lot of times, far more times than he would have preferred to go. And after the first instance with the trocars and the drains and everything, I learned my lesson, and we bought supplies ahead of time. So depending on the quality of your hospital and nursing staff and the amount of money they have, maybe they're quality, but they just don't have a lot of money, you may be sent home with a small amount of supplies. Even if you are lucky enough to have a facility that can give you those supplies to send you home with, they're unlikely to last for more than a couple of days. And the last thing you want to do while you're trying to manage post-surgical care is worry about sending an already overwhelmed helper or loved one to get yet another drugstore run for something else. So I recommend buying a couple of boxes of the following equipment to tide you over until your 1 week post-op visit, and that is Tegaderm in case you need it, or tape in case the other tape comes off. Then at least you have that tape to tape on a new gauze pad. Some saline solution to rinse off the insertion site where the trocars are going in. And some cotton swabs, sterile, not just Q-tips, but a sterile cotton swab to clean around the drain insertion point. Because if your bandage comes off, they'll put some gauze and tape over it. If that comes off, or if you need to take it off, you're going to need to clean. And some alcohol wipes to strip the drains. Stripping the drains refers to holding the drain tube up high and then squeezing it shut, and then taking your other hand and squishing all the fluid down the tube into the drain. And you'll need to do this every time you measure the output in the drain, and it's much easier to run your hand down the tube if you have alcohol pads to run up the tube. It also helps to keep things clean and clean off any gook. So I would buy those few things beforehand. Simple to do, not expensive, but can be so helpful there those first 3 or 4 days. And then the next thing I wanted to talk about was wound care. Even if you only have one incision and a few stitches, incisions can still be really uncomfortable and frustrating. And depending on what kind of surgery you have, you could have 80 or more stitches in multiple incision sites during a single surgery. At one point, I was in that position. I had 4 separate incisions that were all together were more than 4 feet. If you aren't from the U.S., that's a little over a meter's worth of incisions for a single surgery. And I knew that I would have to spend some time with the wound dressings, but I was not prepared for the frustration they would cause when trying to do basic tasks like showering, brushing my hair, going to the bathroom. So here are a few tips for wound care that can help you out whether you have a few stitches or dozens of them. The first week or 2 of wound care will be the most ooey gooey and sticky. That is because even though you'll have stitches and glue, there will still be some blood and fluid coming out from the incision site. That means that the gauze pad the hospital applies to you will stick to the wound. For me, they always stuck. Usually, when you're sent home with a few supplies, the medical staff will give you gauze or a cotton pad. These work really well after about week 2-ish. But before that, they tend to stick to the wound. They when you peel them off, they can pull off scabs. And for me, they really just pulled at the wound and the skin around it, and it slowed down the healing, and it was not good. So my first wound care tip is that I highly recommend purchasing some sterile, non-stick wound dressings. And again, I'm not paid to say this. I did use these and I do prefer them, and they come in several sizes. And if you've had free flap reconstruction that transplants thigh muscles to your chest, you're going to need to get the very long rectangular size and the small square size, because you will need both to cover the majority of your incision. And putting these things on the thigh wound will be a little bit tricky. You'll have to learn how to maneuver it and find a method that works for you in order to get it on and wrap it with ACE bandages. It takes a little practice, but I figured out a technique that worked for me after the first couple of tries, where I could hold it on and then wrap the bandage, and it worked with just my 2 hands. If you don't have particularly sensitive skin, this may not be an issue for you. If you know it's not a problem, maybe you want to skip that purchase. But if you do have sensitive skin, this can be a big help for extra cushioning under the surgical bra. That's the other thing that I use these non-stick pads for. If you have a mastectomy, or even if you choose not to have any reconstruction, they'll still send you home with some wraps around your chest. And if you choose to have reconstruction, no matter what kind you have, you'll be sent home with the surgical bra. The bra has a wide elastic band on the bottom that, once the incision heals, will be very comfortable for you. But in the beginning, it can rub the incision, and that'll be just underneath the breast. And having these, that's going to hurt, right? So having these thin non-stick pads to slip between that elastic band in your skin, for me, made it much more comfortable. And those non-stick pads were much more comfortable than the cotton pads, because the cotton pads would stick to the incision. So they have a couple of uses: A, for the legs as wound dressings, and then B, just to pad everything underneath that thick elastic band. So after the first couple of weeks passed for me, I didn't need any of the specialty stuff so much anymore, and I was able to use all the supplies that the hospital sent home with me in the following weeks of recovery. So my next tip for wound care is really just a heads up about different types of antibiotic ointments. Most of the time, I was not sent home with any sort of wound cleansing wash or ointment until my 1-week post-op visit. In the beginning, they really just don't want anything on there, and that's pretty, I think, universal way to send people home from surgery. So don't add any kind of ointment unless your physician tells you to. And if you notice that there's redness or an infection around the wound or something, then be sure to ask before you apply Neosporin or anything else. You will probably need to go in and have someone look at it if it's red like that. After my first post-op, I was usually given mupryacin, which is a prescription topical antibiotic ointment, and that just made sure everything stayed clean and the wound healed nicely. And however, after my first leg surgery, I had to have 3 leg surgeries, and I had a horrible time with my leg incisions. While it all turned out mostly okay at the end, the initial healing process was really, really difficult. And during that time, I was given a special antibiotic cream made of silver. It's called Silvadine. And this is usually reserved for burn patients. I don't think you can get this over the counter. But it does work great, and I loved it. However, be warned, if you have a similar situation and you are prescribed Silvadine cream for a scar or an incision, do not use zinc wound wash. Just use a saline wound wash. There's two types of wound washes. You can get like a plain saline squirt bottle, then you get another type that is a zinc wound wash. The zinc wound wash is fantastic and works really well, and I actually prefer it, except if you use that Silvadine cream, then the wound wash interacts with the silver and the Silvadine and makes it not work so much. It kind of blocks it. It deactivates, I guess, the silver in the Silvadine. So if you're using a wound wash and then you end up getting that the Silvadine cream, just use saline and check with your physician before you use any over-the-counter product together with anything they give you in office or prescription. And some stuff, sometimes you forget because it just seems so simple and innocuous. Why would I ask about such a thing like that? But the amount of interactions or negative interactions between products that can occur is surprising. And then, so my next tip on wound care is about keeping the incisions dry. So depending on your particular situation and the surgery you are having and other factors unique to your anatomy, you may be told that you must keep the wounds dry at all times for much longer than 48 hours. So if you have tissue expanders in for breast cancer patients, if you're having autologous tissue reconstruction, the portal to put saline in the tissue expanders is always open, and it will take weeks to complete the tissue expansion process. And often you must be very careful not to get the portal area wet. This can get tricky, and showering is a really important, not just for hygiene, but also just mental health and comfort and relaxation's sake. So how do you keep your wounds dry while maintaining good hygiene and getting the benefits of a nice warm shower to relax your muscles? For the drains and portals, I liked using Tegaderm pads to cover all the drains and portals. And for really long incisions, you can use what's called a dry bag, which is linked below. I don't know if you're a Gen Xer, you may remember if you or a friend ever ended up breaking a limb on one of your insane BMX escapades or some other like random unsupervised adventures, then you are probably familiar with the garbage bag and duct tape over the cast method. A dry bag is similar to that. It's basically a plastic covering that you place over the incision, and then you can pull the ends or tape, or sometimes have Velcro, secure the ends of the bag that's over your arm or your leg or whatever. And they come in all shapes and sizes. I've linked a couple below that you can just see what I'm talking about, depending on what you might need for your situation. So yeah, dry bags come in all shapes and sizes, and I highly recommend showering before you change the dressing and do the wound care. That way, if something happens in the dry bag, it gets a little bit on the bandage, you're going to be taking the thing off anyway. You can take the bandage off and then do your wound care and put on the new wound dressing. So your incision is protected and not wet, and even if the bandage gets a little damp, you're going to take it off immediately anyway. So yes, this dry stage where you can't get the incision wet doesn't usually last a very long time. It could last much longer than 48 hours, but it usually doesn't last for weeks and weeks, except in the case of your portal. If you have breast cancer, that's about 6 weeks. Well, actually, no, that's about until you have the expanders taken out, which can be, for me, was 6 months that I had to keep those portals dry, because they didn't want any infection or anything happening there. So depending on your situation, it can be a long time, but where you're keeping incisions dry, luckily the dry bag is not a long-term thing in most cases. So my final wound care tip involves the thing we all must do, no matter our fate. We must pee. What goes in must come out. So if you are maybe a little shy, this part of the video might not be for you, but if you are having surgery on your legs or free flap reconstruction using thigh muscles, this tip may prove to be useful. So I'll start by explaining a little bit about what to expect with this surgery, this specific free flap reconstruction from thigh muscle. So these incisions are going to run from your knee to your pelvis, all the way up your leg. And you will have compression garments on eventually. For the first couple of days, you may not have them, but then then you'll put them on. Depends on the type of surgery and where you are in the process. Sometimes you will put them on before you leave the hospital. So it'll vary depending on where you are. And I'll talk about peeing with compression garments in a different video. But usually for the first 48 hours before you put the garments on, you will still have ACE bandages on your thighs, especially after the very first surgery. And things could get very messy. The ACE bandages will wrap all the way around your leg, all the way from the knee to the top of your thigh. And when you sit down to pee, all of your anatomy used in peeing may not work the way that it did before you were catheterized for 13 hours straight, because this surgery is a major surgery. It takes a long time. And mine did last about 13 hours. That's a while to be catheterized, and you're going to be swollen, as well as the fact that your incisions are going to go all the way to the top of your leg. So that whole area is just going to be swollen from surgery as well. And it will take a few days for that to go down and for everything to go down the way that it was supposed to. So because of all of those things, the catheterization and the swelling, when you pee, it might go everywhere for a couple of days. And then you've got these ACE bandages on that you're supposed to be keeping dry, and it's like, what is going on here? And that can be very frustrating. So a solution that I found to keep the bandages dry and clean, so that you are not changing them all the time, but you're just doing your regular once a day dressing change, I used cling wrap or saran wrap. Some people call it either one. Well, I would just get a tube of clear plastic wrap, cling wrap, saran wrap, and I kept it in the bathroom. And before I had to go to the bathroom, I would take a strip of the cling wrap and wrap it around each thigh at the top of my thigh. That way, when I was sitting down to go to the bathroom, anything that went where it wasn't supposed to go would hit the cling wrap, and I can take it off and throw it away, and then my bandage stayed dry. So yes, this is using plastic. Yes, that's not the greatest for the environment, but I would rather use it short term and then have to change out my bandages and put them in the washing machine every single time that I pee. So you will have to make choices that you feel are best for you, but for me, I prefer to just use the cling wrap and not stress over it, because just the act of sitting and standing puts pressure on the incisions anyway, and that's painful, and you'll need to work with a physical therapist and a nurse before you are discharged from the hospital to be able to figure out a way that works with your particular body to get up and down effectively. And you may need some help, someone to help hold your hand and steady you as you're trying to get up and down. The last thing you need is, on top of that, to have to be washing pee dressings, pure peed on dressings. So you just save yourself the trouble. I urge you to think about what is easier for you in your care at that time. So those are my kind of my wound dressing tips and keeping them dry. Now, so the other thing